to the Get Fit podcast. I'm here with my good friend, Dr. Rick Longie. He is owner here at Longie Chiropractic. Kind of a very special friend of mine. Not only is my chiropractic doctor, he's also a good friend of mine. So, welcome to the show, Doc.
Thank you very much. Well, I appreciate it.
Well, one thing I also need to say thank you to is Longie Chiropractic is our platinum sponsor for the Get Fit initiative for 2021. We wouldn't be able to bring you these fun things like the Get Fit Weight Loss Challenge or the Get Fit podcast without support of Dr. Longie and his crew down here. So thank you again for that, sir.
Well, you're welcome very much.
Absolutely. So, Doc, tell me a little bit about why you got into chiropractic.
Well, that's a loaded question.
It is.
I actually had an aunt that had a son, and my older cousin's a chiropractor out in Oregon, Klamath Falls, Oregon, Dr. Ed Vietz. And we sat one time when I was young and we talked about becoming a chiropractor like my cousin. And it just stuck. And then I actually used to work at the Daily Democrat.
Yep.
All through high school. And an event happened there at one time, and it just, something clicked, and I said, I'm going to go to college right after high school and become a chiropractor, like my cousin. Then, visiting my cousin when I was 19, he checked my spine. I used to have recurring headaches, and I'd also get these nosebleeds. All of a sudden, I'd be sitting in class, and my nose would start bleeding. Well, he checked my neck, and he found that there was a subluxation, which is a bone out of place pinching a nerve in the neck, and he gave me my first chiropractic adjustment. 2 weeks later, I was realizing my headaches were gone, and my nosebleeds had quit from one chiropractic visit. So it kind of started my trajectory and putting me on the path to become a chiropractor.
Well, I've known you for a couple of years, and I didn't know that story or why you ever got into it. So when I think of chiropractic, I think, I know the back end of it, because I'm passionate about chiropractic, but, a lot of people think, oh, it's just, they can snap my neck or, reset my back. What is chiropractic, and how did chiropractic come to what it is today?
Well, chiropractic was founded in 1895. That was the first chiropractor and the first chiropractic patient. And according to history, Harvey Lillard, an African-American janitor, picked up a wagon wheel about 17 years earlier. Something in his neck popped out of place, produced a big lump, and he went deaf. The first chiropractor listened to his story 17, 18 years later, felt the lump, and reasoned that if he could reduce the lump, Harvey could regain his hearing. And 3 first chiropractic treatments later, he did. And that was the start of chiropractic. So chiropractic is based on the premise that the brain and the spinal cord make up the central nervous system, and all the nerves that branch from the brain and spinal cord control and coordinate all functions in the body. Now, what does that mean? Well, you have a function when you eat a taco, you're going to digest the taco, correct? So the brain actually controls that digestive process. If you you want to reproduce, your reproductive organs make eggs and sperm, and they collide and become a child. But some people cannot get pregnant because they have a lower back issue. Mm-hmm. Some people have sinus headaches. Some people have headache. They call it sinus headaches. But a headache is a headache. Whether it's a migraine, a tension headache, or a sinus headache, something causes that pain or body to hurt. I always use analogies in my office with my patients because I like to teach as we go along. But if I stand on someone's foot with all my weight, it's probably going to hurt. Mm-hmm. Some people think the pain's the problem. Most of us would say, no, you're standing on my foot. Get off my foot. So if a bone in the spine gets out of place, it can actually pinch a nerve root. And that nerve root, only about 10% feel pain, but 90% of our nerves make other things work. Like if I want to contract a muscle, my brain sends an impulse through my nerves to my muscle to contract. And it tells it how much to contract based on my process of thinking.
Right, that makes sense.
If there's an interference from the spinal nerve root or from the brain to that muscle won't contract as well. Or maybe it stays contracted and won't relax. I remember several years ago, a good friend of mine that used to repair equipment, his wife called me up. Her name was Pam. She was 30 years old. And she said, "Doc, I want to get pregnant. Can you help me?" So we laughed about it a little bit. And I had some fun, but I said, "Well, Pam, what's going on?" She said, "Well, Carlos and I got married about 3 years ago, and we decided we want to have a baby. For 2 years, I've been undergoing fertility shots to try to get pregnant. They tell me my ovaries are not working right, and that I have ovarian condition, and my ovaries will not release the egg, so I can't conceive. But I heard through the grapevine that maybe a chiropractor could help." So I explained to Pam that the nerve system in the lower back that connects the nerves to the ovaries and uterus could be a problem. So come in, we do an exam, we take some x-rays to determine if she has a misalignment or what we call a subluxation, pinched nerve in that lower back. And sure enough, she did. She had no lower back pain whatsoever. A lot of people go to chiropractors for lower back pain, but Pam did not have any pain, but she did have interference, and when we touched the bone that was out of alignment, you could definitely feel it. But you could also see it misaligned on x-ray. That's why in chiropractic, I would never let my daughter go to a chiropractor or myself without x-rays of my spine. I don't want them guessing with what they're doing. So we do things a bit different here than maybe others. We're going to be real specific, real scientific on what we look for and pinpoint the problem area and work to fix the problem.
Absolutely.
Well, lo and behold, Pam came to my office 2 to 3 times a week for 5 weeks, and then one day on a Wednesday, Carlos came in with her. And he pointed his finger at me and took me back to a private room, and he said, "I don't know what you did, but my wife is pregnant." And he did know what I did.
Yeah.
Because he'd been a patient of mine, and his former wife actually, they'd had a child together. And so we laughed about it a little bit, but they had did the test. Sure enough, Wyatt now is about 14 years old. And he's only one of
several. I hear it a lot. I hear that a lot.
So we first always look at function, the function of the body. What's controlling the function? Well, we learned that the spine, the nerve system, control and coordinate. How many functions in the body? All of them.
All of them, yep.
So, now some people are mistaken thinking that when we say that chiropractic now is a cure-all for everything. And we have never said that. But we do know that the body is controlled by the brain and nerve system. All the textbooks say it. But yet, then we try to treat a physical problem sometimes with a chemical.
With a chemical, yeah.
And it doesn't fix the problem. And so the pain keeps coming back time and time again. Surgeons like to do surgery, and sometimes surgery is indicated, but it should be a last resort, not the first thing you do. But Pam had a lower back issue that affected the nerves. Basically, it's kind of like having a fuse box, and you've got a fuse that's popped.
Yeah, absolutely.
And it's not getting the energy or the juice to the room, so the room won't light up.
Yeah, I think the same thing too. If there's something not working correctly in the body, it's not gonna affect one thing. It really affects everything. When I come in here, one thing that you work on me quite a bit is my shoulder. So it doesn't only just have to be a neck or a back or whatever. You do chiropractic works on really any joint and alignment.
Well, many times we do have patients. Our 95% focus is on the spine, the neck, the mid back, and the lower back. But 5% go elsewhere. Sometimes there's a pinched nerve in the wrist. Sometimes it's in the ankle. Sometimes there's joints that get misplaced. Shoulder joint, elbow, wrist. A lot of people have surgery on their carpal tunnel, which many times leaves them weaker than the beginning. Not always, but sometimes. And sometimes all they really needed, in my opinion, was get their neck fixed. That's the nerve control to the wrist. And then sometimes the wrist or carpal bones can become misplaced. Carpal tunnel is actually a normal thing, but having a syndrome is not.
Right.
So we should have a tunnel in there that lets the nerves and tendons go through. But when it gets misaligned, then it doesn't function good.
So let's say I'm a new customer or a new patient. My lower back's killing me. I call up the office. What's the process of when a new person comes in? What do you do with the new patient?
Okay. Well, like most doctor's offices, we're going to gather some information first. We want to kind of know your history. We'll have you fill out some information. Then you'll schedule an appointment to come in for a consultation and an examination with me. And we also do a full set of x-rays. We only accept patients for care that we feel 100% confident that we can help. So you first have to have a misalignment in your spine, pinching, irritation on your nerve system. But we start with a thorough process. And I spend usually 20 to 30 minutes on each patient's x-rays, analyzing, measuring, finding the actual misalignment.
See where the issue is.
Yeah. Then on your next visit, or your second visit, a follow-up visit, we sit down with the patient, go over their x-ray findings. We grade conditions in phases. We have a near normal, then we have a phase 1 condition, phase 2, phase 3. Phase 3s are so permanent and so badly damaged they can't be repaired through chiropractic knee. But if you can catch a patient in a phase 1, phase 2, you can make some magnificent changes in their spine and in their spinal health. But we sit down and outline a program, much like an orthodontist would work out a program to straighten your teeth. We want to not only get you feeling great, we want to straighten the spine out as much as possible.
Absolutely. So how does somebody, if I'm in need of chiropractic care, and I think Longie Chiropractic is an amazing option, how can somebody get a hold of you?
Well, they can call the office at 660-829-2600. That's 660-829-2600. Or they can go online to www.longiechiropractic.com and they can send an email request for an appointment. We do occasionally take walk-ins, but it's much better if you have an appointment.
And speaking of walk-ins, the office is located right behind the Thompson Hill Shopping Center.
Correct.
What's the address here?
It's 910 Thompson Boulevard here in Sedalia. And this office has been located here nearly 20 years. I've actually been practicing for 42 years. Well, I was saying, Will, that I practiced in Tennessee, in the Nashville, Tennessee area for about 29 years, and did a lot of research on how to help a patient get well quick and get the best results in the shortest amount of time possible. And we really enjoy helping folks. Had a lot of interesting stories. But the sad thing is people suffer too long, and they many times don't have to do it. Sometimes within just a few short visits. I had a young man in Nashville came to me with a migraine headache that was with him every minute of every day for 3 solid months. He had seen, as I recall, 5 neurologists, had Botox injections. They did everything they could imagine. So he came to my office and I told him, I said, well, you know, I love migraine patients. He said, why? And I said, well, because usually within a few short visits, they love me back. Because if we're able to help you, you'll see results pretty quick. Literally within 2 chiropractic adjustments, 2 days in a row, he came back in the office and he saw me down the hallway and he yelled, I think I love you, Dr. Longie. But his headache had went away after 2 specific visits. But his problem was a misalignment in his upper neck and had moved to a certain position. He had actually 2 vertebrae, and when we were able to treat those and take pressure off the nerve, his symptom disappeared. And so he was in love with chiropractic.
And Dr. Longie.
In my office.
And I'd like to say that one of the reasons Doc came back from Nashville, my wife was at a chiropractic conference. My wife is the office manager here, and I was sitting in a room with a bunch of chiropractors, and we were going around the room talking about where everybody participates. And I said, well, you said, I'm not a chiropractor. I publish a newspaper in Sedalia, Missouri. And the very next guy to talk was Dr. Longie. He said, I still have nightmares. I said, about what? He said, when I was a kid, for all those years, I still have nightmares about stuff in the inserts of the paper. So it is a small world when you think about it.
But it was an excellent job and gave me a lot of great education.
I appreciate you saying that.
No, I was, seriously.
Well, Doc, is there anything else you want to say before we sign off here?
Well, you know, too many people, I think we've learned how to suffer. I had a lady come in just the other day, and she's been having recurring headaches 2-3 times a week for like 11 years. And back pain that keeps recurring and recurring with no real help, you know, taking pills or potions or seeing the MD for a shot. Nothing was really helping that person. And so many times we're suffering, We don't know, is there an answer, is there a solution? But covering up symptoms with drugs makes your condition worsen over time instead of actually get better. You can't kill pain by just treating it with a pain pill. You've got to get to the source and the cause. So my recommendation, call the office. Consultation here with me is always free. I never charge for that. If I didn't think you were a chiropractic case, I tell my patients. If I think we can help you, then we proceed. Currently, I think this month, a complete examination and x-ray is only $59. So we keep that entry fee really low to find out what's wrong, to help a patient get started under chiropractic care.
Well, very good. Well, again, thank you for being on the show today. Thank you for your support of the whole Get Fit initiative. It means a lot to me, and I know the community sure appreciates it. So thanks for everything you do.
You're welcome. Thank you very much.
Yep. Have a good one.
You too.